Hi, we're going to be talking about the approach to altered mental status, and specifically, we're going to be talking about how to approach altered mental status in the emergency department. We're going to start out by talking about some definitions here. So, altered mental status means that a patient is presenting confused. They have acute alteration in their higher cerebral function. And what that means is that they are going to have problems with their memory, they're going to have problems with their attention, and they're potentially going to have problems with their awareness. So they may not be able to fully cooperate or engage in an exam or in the history process with you. It's important to note that this is an acute change, so it's something that's different than what happened before. And it's important to distinguish this from dementia. So dementia is when someone has altered mental status that progresses over a longer period of time. Altered mental status is something that happens acutely, so it's something that happens days or hours before the patient comes into the emergency department, not something that happens over weeks to months. It's important to note that this is a symptom. It's not actually a diagnosis. So what that means is this is something that someone's going to be coming in complaining of. And our job in the emergency department is to look back and try and figure out what is causing this altered mental status. Delirium is another definition here. And what delirium means is it means that a patient has waxing and waning altered mental status. It's important to think about delirium in the sense that sometimes when you see someone who comes in, they may be acting normal or reasonably normal when you see them. In these patients, it's very important to get a history or some information from a family member or from someone who might know them a little bit better or can tell what's been going on. Because even though someone appears to be normal in the emergency department, it might be that they've had confusing episodes or have had concerning symptoms over the last hours to days. And it's very important that you try and get that information. When we're approaching altered mental status, there's a very broad differential. There's lots of different things that could be causing it. Dyspnea or shortness of breath is one of them. And dyspnea generally causes it by hypoxia, so your oxygen levels get very low, and that can cause altered mental status. Or if you are unable to ventilate appropriately and you have elevation in your carbon dioxide levels, that's another thing that can cause altered mental status. So it's very important that you get a history from the patient or from their medical record to see if they have a history of lung disease. Head trauma is something else that can make patients be altered. And it can make people be altered in various ways. So it can make them be altered because they have a concussion. It can make them be altered because they have bleeding in their brain. So there's various ways that a blow to the head or a head strike could make people be altered. Head trauma can happen if someone was in a car accident, if someone was, hit by a car, on a bicycle, lots of different mechanisms for head trauma. Fever is another thing that can cause altered mental status. It's very important when we're thinking about fever that we think about the most accurate way to measure temperature. So oftentimes temperature is measured orally by putting the thermometer in someone's mouth. And sometimes the temperature is measured with a forehead thermometer or with a thermometer in the ear. The most accurate temperature reading you can get, though, is a rectal temperature. So if you're worried that your patient has a fever that's not being detected using the other methods of taking a temperature, you may need to go ahead and go that extra step and take a rectal temperature for that patient. Electrolyte abnormalities, also included in the differential here. The most common electrolyte abnormalities that can cause patients to be altered are a low sodium level. You can get low sodium levels by a variety of mechanisms. So by drinking too much free water, drinking too much water basically from the tap. Sometimes drinking too much beer can actually cause a low sodium level. Other electrolytes that can cause altered mental status would be an elevated potassium level. And then also an elevated sodium level as well can make patients be altered. And then infectious symptoms is something else that can cause altered mental status. So patients who have meningitis, which is an infection around the brain, patients who have pneumonia, patients who have a urinary tract infection, especially in elderly women, if they have a urinary tract infection, sometimes the only symptom they may present with is actually altered mental status. So very important to make sure that you're thinking about infection as a cause here when patients present with confusion. So what are the four most common causes that we want to make sure we're thinking about? So systemic disease that is affecting the central nervous system. And we talked about some of those already. Infection is definitely one of them that can do that. Fever sometimes as well. Primary intracranial disease. A classic thing here is if someone has something called a hemorrhagic stroke, which is basically bleeding into the brain tissue itself. Subarachnoid hemorrhage is another cause that can potentially cause people to be altered or confused. Exogenous toxins, those are substances that patients may ingest, whether they're illicit substances like alcohol or benzodiazepines or opioids, or medications that are prescribed also can sometimes cause patients to have altered mental status. And then drug withdrawal states are very important to consider. The classic drug withdrawals that will cause altered mental status are alcohol withdrawal and benzodiazepine withdrawal. And when we're thinking about those are going to be reflected in the vital signs for patients. So patients can have an elevated heart rate, elevated blood pressure, and confusion. Some patients may present with seizures as well. So that's something definitely you want to make sure you're considering. Sometimes, again, that history can be challenging to get from a patient. So the medical record or talking with a family member or a friend or someone who knows the patient may benefit you. When we're thinking about patients who present confused, it's important to think about what doesn't cause altered mental status. So what are things that don't cause confusion or that we're not necessarily talking about here? Psychosis is one of them. Psychosis is a disorder of reality testing or a thought disorder, and it's primarily caused by underlying psychiatric illness. So patients who have schizophrenia can present with psychosis. There are also sometimes substances that can make patients or cause patients to be psychotic. And if you are concerned that someone has those, you can potentially send a toxicologic screen to think about that. Strokes and tumors are the other thing that rarely cause global cerebral dysfunction. So rarely will they make a patient globally altered. Patients who have strokes may present with weakness in a certain area of their body, but rarely does it cause overall confusion. Things that may mimic confusion, though, are if a patient is aphasic. So if a patient is unable to speak and not able to communicate with you, you can imagine that patient may come across as confused. The same thing goes for any kind of visual field abnormality. If a patient isn't able to move their eyes a certain way or look at you, that also may mimic confusion. What are the first things that we want to do when patients present with confusion to the emergency department? The first and primary thing you want to do is you want to make sure that you check a blood sugar because hypoglycemia, a low blood sugar, is a classic thing that can cause altered mental status. We want to make sure that we think about this every single time because if we're not thinking about it, then we won't think to check it. The other thing you can do is you can administer D50. D50 is a concentrated glucose solution, and if you're not able to check a blood sugar quickly, you can go ahead and give that D50. You also want to consider giving thiamine prior to giving glucose administration. And mainly you want to do that in patients who you're concerned that they may be malnourished. So a patient who is a chronic alcoholic or a patient who doesn't have regular access to food. Because if you give glucose prior to giving thiamine, you can precipitate Wernicke's encephalopathy and cause further problems for the patient down the line. Naloxone is the other medication you want to consider giving when patients present with altered mental status. What naloxone does is it reverses opioid intoxication. So you want to think about giving this to patients in whom you're concerned that they used opioid medications, and that is what led to their altered mental status. Opioid medications can be used via injection drug use. So heroin is the classic thing that we think about, but there's also a lot of oral opioid medications that are prescribed. Oxycodone, Dilaudid are two common medications that patients may be prescribed as outpatients. So it's important that we know not to limit this just to patients who are injecting drugs. Patients who have overdosed on opioids, the classic thing that they'll present with is pinpoint pupils and or respiratory depression. So their respiratory rate will be very low. Down to about 10. Now in Baltimore, where I come from and where I practice emergency medicine, opioid overdose is very common. So this is a medication that we frequently give when patients present with altered mental status. But definitely you want to think about giving this if at all you're concerned about it. It will rapidly reverse the opioid intoxication, and your patient will generally wake up pretty rapidly thereafter. The last thing that you want to think about doing is applying oxygen to your patient. So if your patient is hypoxic, you definitely want to go ahead and put them either on nasal cannula oxygen or a face mask. And if you're worried that a patient is having ventilation issues, if you're worried that their carbon dioxide level is very elevated, and that may be based on a history of obstructive lung disease, then you want to think about starting your patient on BiPAP. BiPAP stands for bilevel positive airway pressure. And what that does is it helps the patient with both oxygenation as well as ventilation, and it helps them exhale that carbon dioxide. So what is a good clinical pearl here for you to take home? It's important to remember that hypoglycemia is a common thing that people can present with, and it's rapidly reversible. Especially in your patients who are diabetic, who are on insulin, you definitely want to be thinking about low blood sugar. You always want to check a finger stick on patients who have altered mental status. I've been fooled before and thought that hypoglycemia wasn't the cause, and I've admitted someone actually to the medicine floor without checking a blood sugar. And you definitely want to make sure that you do this before you go ahead and think about other causes of altered mental status. Now, if you're unable to check a finger stick for whatever reason, your glucose monitor isn't working, you don't have a nurse available to get it for you, but you have rapid access to D50, go ahead and administer that medication. Now, if your patient doesn't have an IV, if they have very challenging IV access, again, if you don't have anyone available to get that, but you do have access to a medication called glucagon, you can go ahead and give that instead. Glucagon is a medication that's administered intramuscularly, but it can take a little bit more time to work. And you also want to think about the use of glucagon in a malnourished patient, because essentially what glucagon does is it goes and it acts on the liver, and it causes release of the glucose from the liver. So in order for glucagon to work, your patient needs to have adequate stores of glucose in their liver. Now, if a patient doesn't have adequate stores of glucose in their liver, glucagon really might not be as effective. Thinking about the history for altered mental status, it's important to involve collateral information. What do we mean by that? We mean that you should make every effort that you can to talk with family members, to talk with EMS, so whoever brought the patient in, and also to try and access the medical record to see if patient has any records either in your computer system or potentially if you're able to access records from other hospitals. It's very important that you get this information from people because A, the patient may not be able to tell you that, and B, if a patient presents with delirium, they may seem pretty normal to you when you see them, but if you speak with family and you find out that they were acting very confused an hour ago, that's something very important for you to know because the patient may again then later on in the day or in the evening time become confused again. You always want to ask about any kind of new medications. By that I mean you want to ask about prescribed medications, you want to ask about medications that someone may have gotten over the counter. So anticholinergic medications such as diphenhydramine is a classic one that can cause altered mental status, especially in elderly people who can be more sensitive to those medications. And you also want to ask about any kind of herbal supplement. Patients sometimes go ahead and they go to the natural store and they buy medications that they think may be safe for them, but it might interact with another one of their medications, or it may cause them to be confused. Substance use and abuse is very key to ask about here. There's a lot of substances that can cause patients to be altered. Anything ranging from alcohol to benzodiazepines can all cause altered mental status, and there's lots of stuff in between. So finding out if a patient uses substances is a very important question to ask. Time course is also very important. It's important to note, did this develop over the last few hours? Did this develop over a few minutes? Did this develop over months? Generally, what we're talking about here is altered mental status that develops over hours to potentially a day or so. We're talking less about the altered mental status that develops over a course of months. It's also important to talk to your patient about any associated symptoms. Again, you may need to talk with their collateral information. So you might need to talk with their family member about whether or not they've had any fevers at home. Try and find out from your patient if they've had any chest pain, any shortness of breath. Was there any seizure activity? So were they observed shaking all over? Were they observed with any kind of incontinence of urine or stool? Did they have any trauma to their mouth? All of those things can be associated with seizure. Chest pain and shortness of breath are definitely important things to kind of ascertain from your patient, especially as people get older. Chest pain can sometimes be not as prominent as a presenting symptom, but can actually be indicative of a patient having a heart attack or an MI. When thinking about the physical exam, the most important thing that you can think about are the vital signs. I always tell my students and my residents that vitals are vital. So it's very important to make sure that you have a full set of vital signs on all patients who present with altered mental status. Fever is a very important vital sign here. You want to see if your patient is febrile or if they're not febrile. Sometimes that means that you have to check a rectal temperature in order to see what their actual temperature is, and that's the most sensitive and accurate core temperature that you can get. Blood pressure, also very important. A very elevated blood pressure can point you in the direction of a problem in the brain, like a hemorrhagic stroke, and a very low blood pressure can point you in the direction of sepsis or infection. Heart rate, also very important. Heart rate is important in thinking about toxidromes, so thinking about possible substance use. Heart rate also, if it's elevated, can make you think about sepsis or infection. Oxygen levels, low oxygen level, hypoxia can definitely cause altered mental status. And if you notice that, you want to make sure you put your patient on oxygen. And then last but not least, the respiratory rate. Respiratory rate, I say, is oftentimes a very overlooked vital sign. Respiratory rate is important because an elevated respiratory rate can be a marker of sepsis. And then a low respiratory rate, very important because it can be a marker of opioid overdose. You want to look for head trauma. Patients who present with altered mental status might not be able to tell you that they hit their head. So a very important thing to do is make sure you take your patient's hat off, make sure you feel all over their head to make sure that they don't have a big knot on their head or something that would make you think that they've had head trauma that they're not able to communicate to you. You want to try and quantify their altered mental status. Are they confused when you're talking to them, or are they not confused? Sometimes, like I said, patients, when they present with confusion as the chief complaint, may not necessarily be confused when you're seeing them. You could think about the GCS score, the Glasgow Coma Scale score, can sometimes help you figure out if your patient is altered. And generally just talking with your patient and figuring out their orientation. So you want to ask them the date, you want to ask them their name, you want to ask them where they are. Sometimes patients can have problems with those questions, especially if they have underlying dementia. So sometimes it's helpful to ask who the president or a leader of their country might be. And sometimes they might know that rather than knowing the exact date. Toxidromes basically are groups of findings which indicate that a patient has ingested or used a certain substance. The key things involved in toxidromes are a pupillary exam. Are the pupils dilated? Sympathomimetics, like cocaine, can cause pupillary dilatation. The skin exam is very important. There are certain overdoses that can cause the skin to be dry, cause the skin to be warm, cause the skin to be red, whereas other things can cause the skin to be pale and cool and clammy. Also involved in a lot of those toxidromes are the temperature. There are substances when they're ingested that can cause elevated temperature as well as lower temperatures. So how do we approach altered mental status in a diagnostic capacity? So there are some screening tools that we can use in the emergency department. One of them is the mini mental status exam. And what this basically can help us do is it can help us see if our patient has an underlying delirium. And this is a series of questions that require the patient, mainly it tests their ability to pay attention and figure out the questions that are there, and can help us distinguish also between whether or not this is a psychiatric illness that's causing them to present, or whether this is more of an organic cause that's causing their confusion. The quick confusion score is another thing that's sometimes utilized in the emergency department, which is basically a series of questions that can help determine whether or not your patient has delirium or not. You also want to send focused blood work for your patient and lab work. That generally consists of a CBC, so checking a blood count, a urinalysis, electrolyte analysis, things such as elevated sodium or low sodium, elevated calcium. Renal failure can also cause a patient to be altered. So a patient who has a very elevated BUN level can lead to altered mental status. Liver failure can sometimes lead to altered mental status as well. If you're worried that your patient has liver failure, another lab that you want to check is an ammonia level. It's important to think about the ammonia level. The ammonia level actually doesn't necessarily always correlate with the patient's symptoms. So sometimes a patient can have a very elevated level of ammonia, but may not necessarily correlate with their exam. So you definitely want to think about it in line with your patient. So if your patient is very confused and they have an elevated ammonia level, then that's something you want to think about. If you think your patient may have used a substance that you're not able to necessarily figure out, you can send a urine toxicologic screen. It doesn't oftentimes make a change or a difference in patient management in the emergency department, but it's something that can potentially be helpful or potentially help guide you a little bit. So there's lots of different labs that we can think about sending. An alcohol level would be another one. If you're concerned that your patient is intoxicated and you want to see what their alcohol level is, you can go ahead and send that. And a urinalysis as well. Then you want to think about focused imaging. What this generally means is we're thinking about whether or not our patient needs a CAT scan of their head. This is when it's important to go ahead and see if they have any evidence of head trauma or if you're worried that they have a bleed in their brain. And in those situations, you want to go ahead and get a CAT scan of the head. Other things that can cause altered mental status, we talked about infectious symptoms that can cause altered mental status. So definitely getting a chest x-ray may reveal a pneumonia. If someone is having abdominal pain, along with their confusion, you might want to consider getting a CT scan of the abdomen. So there's lots of different reasons for altered mental status, and you want to make sure that you're thinking about them in line with choosing whether or not to do certain x-rays or CAT scans. So the key things to think about when you're managing patients who have confusion, you always want to treat hypoglycemia immediately. So if you're unable to check a blood sugar level and you're worried that someone is hypoglycemic, go ahead and treat. And once you get the test back and you find out that someone has a low blood sugar, definitely make sure you treat that immediately. Thiamine is the other medication to consider giving, especially for patients who have underlying malnourished state, patients who are alcoholic or chronic alcohol use. And thiamine, when administered prior to glucose, can prevent Wernicke's encephalopathy. Naloxone can reverse opioid intoxication. And the three of these things together, so glucose, thiamine, and naloxone, all three together, is sometimes known as the coma cocktail. Now, for patients who present agitated, which potentially may be patients who are in alcohol withdrawal or benzodiazepine withdrawal, sometimes patients after a seizure, you want to consider sedating those patients. And the reason that we sedate patients in the emergency department is to make sure that the patient is safe, as well as to make sure that the staff is safe. So for patients who are agitated and are potentially threatening or potentially able to harm themselves, consider giving those patients sedating medications. One very important thing to remember here is that delirium has a very high associated mortality. So if you're worried that your patient has delirium, have a very low threshold for admitting that patient to the hospital, especially if you're not able to figure out the underlying cause or the etiology. So the conclusion here is confusion is a symptom rather than a true diagnosis. Whenever patients present with confusion and altered mental status, it's important to go ahead and do some digging and look for the underlying cause. Focal abnormalities such as tumor or ischemic stroke, so a blood clot that's causing a stroke, rarely cause altered mental status. The key initial steps, the key things that you want to do for all patients with altered mental status is you want to consider and treat hypoglycemia, hypoxia, and in the appropriate setting, you want to reverse opioid toxicity. You want to consider using a structured screening tool to further help with diagnosis of delirium. So that would be the mini mental status exam, the quick confusion score. And the last most important thing is to keep in mind that delirium has a very high associated mortality. Have a low threshold for admitting these patients, especially elderly patients, patients who are not able to find the etiology for their confusion. Definitely make sure that you're thinking about admission and thinking about the underlying cause and the most serious underlying causes, especially in the emergency department.